Hello, my name is Natasha Holly, Clinical Director here at Integrated Family Services. Integrated Family Services prides itself on being a provider of a wide variety of quality behavioral health services. Our service array includes mobile crisis services, psychiatric services, intensive in-home services, day treatment, foster care services, and counseling services. We would like to take this opportunity to share with you some feedback that we have received from our community stakeholders and consumers.
Hello, I'm Mike Kopecki. I'm Assistant Director for East Carolina Behavioral Health. East Carolina Behavioral Health is a local management entity serving the eastern 19 counties. Local management entities are responsible for managing and providing services to persons with mental health, developmental disabilities, and substance abuse services. East Carolina Behavioral Health contracts with Integrated Family Services to provide mobile crisis in 16 of our 19 northeastern counties. Mobile crisis teams give people in crisis an opportunity to be served in their own home. Mobile crisis helps the community by keeping individuals out of very costly emergency department visits. Mobile crisis is very much like emergency management service, in which they're only a phone call away. East Carolina Behavioral Health puts a lot of value in mobile crisis services. During last fiscal year, in our 19 counties, 1,043 individuals were served. Of those 1,043, 769 individuals were diverted from costly emergency department rooms and hospitalizations. A day in a state facility such as Cherry Hospital cost $1,250. A day in a community mental health hospital cost $750. Mobile crisis is of value to the taxpayers and citizens of North Carolina.
My name is Dee Dee Green. I'm from Greenville, North Carolina. I came involved with Integrated Family Services on a Friday evening of the beginning of this year. I was going through some issues, and I got connected with Mobile Crisis, and they helped me through a lot of things. They helped me with my kids, and they helped me with my housing. Miss Leslie is my caseworker. She helps me look for my home that I have now. I had issues with financial issues and therapy, which helps me a lot. I'm not as stressful as I used to be. Integrated Family Services, they help me a lot. They help me with my self-esteem. They help me with my financial issues. I learned how to control a lot of things now. Basically, they gave me support when I thought I had none. And without them, I wouldn't probably know what I would do now or where I'd be if it wasn't for them. And I thank God that I met them at the right time.
My name is Bonnie Curry, and I'm the Crisis Intervention Team Training Coordinator for 19 counties that East Carolina Behavioral Health serves in the East. We have Integrated Family Services help us by providing presenters. Our presenters in the training are experts in the field, and they come in and they provide information on topics such as substance abuse, the adolescent, special concerns of the geriatric population. Mobile crisis and law enforcement partner in responding to calls when individuals are in crisis. Family members know that mobile crisis is there when their loved one is having a mental health crisis, and family members feel very secure that they have someone that they can call 24/7. Also, our school resource officers have found Mobile Crisis to be a partner that has helped them throughout their school year. They keep the Mobile Crisis cards, rack cards with them, so that they can educate parents on the services that Mobile Crisis provides, so that if a crisis should happen outside of the school hours, that family members feel secure that they have someone that they can call if things should get out of hand and escalate. Before Mobile Crisis began services in Pitt County, law enforcement officers and individuals with integrated family service sat down and talked about the mobile crisis program. And they talked about how to make it happen so that they could work as partners in responding. And it was through discussions that went on for several months that we laid the foundation so that when the actual service started, officers were able to hit the ground running, and they knew that if they responded to a call and that the person in crisis really could benefit from having a trained mental health worker come and talk to them, that they could call on mobile crisis and that they would be there, they would respond. I think it's important that everyone in the community know that mobile crisis services are available, and it's just a matter of calling the number 24/7. If you see anyone in the community that may be struggling and they appear to really need some immediate assistance, that mobile crisis is available, and they come where you are. You don't have to go to them. You can be assured that they are going to come and they're going to have the skills that will really help you get through whatever the event is, and also to take it one step further and to follow up with your care and to help you get connected and linked to all the great resources that we have here in eastern North Carolina.
My name is Jeremy Hewitt. I'm a patrol sergeant with the Beaufort County Sheriff's Office. I've been with the Sheriff's Office for 6 years. I've been a sergeant for 2 years. We've been working with mobile crisis services since they came to our community. They're a great asset to the community and bridging the gap between law enforcement and the community when it comes to mental illness and mental health. Since mobile crisis services came to Beaufort County, it's given us another option of dealing with mental health issues, whereas before our only option would be to take somebody to the hospital and do the involuntary commitment process. This gives us a way of trying to get another service in that's a little bit more hands-on to try to help the person get through the crisis without them having to go to a hospital. However, if the situation dictates that they do need to go to the hospital, that's still a route that mobile crisis will take and will assist the family in doing. They also do follow up with the people, with the clients, to try to keep from a relapse happening and to help them get on about their lives and recover from the incident that they were suffering from. They've helped us out a lot. It's an asset that we use on a regular basis, some months more than others. The biggest thing is with the involuntary commitment process. Before, we would be tied up and pretty much have no option but to go that route with any issue regardless of the severity of the issue. And now we can make a judgment call to find out whether it's a situation where we need to go that route, or we can contact them and have them come in. We stand by with the client until they arrive and make sure everything's going to be okay. And a lot of times that provides a better service to the client than the other route, whereas we'll take them to the hospital and they'll just find that they need to go back home and they don't get any services at all other than blood work and preliminary simple stuff that takes up half of their night. They've been a great asset to the community. You've seen a lot of people call us back and thank us for using mobile crisis services and having them come out. And also their services go into, other than mental health, they go into domestic violence and other family-related issues. Whereas before, domestic violence was either criminal or not criminal. And once we got there, if it was not a situation where we had to make an arrest, we would just clear the call and people were left to their own devices to try to figure out how to solve the problem. Now they have another option of having another third party come in and look at their situation and try to provide them a means of recovering from it and learning how to get along as a family so that they don't have to fight and have law enforcement called to their residence in the future. So they've provided a lot of assistance in the community to the members of the community for multiple aspects, even down to deaths in the family. We've utilized them for deaths before where the person was traumatized by losing a family member. We call them out and they help the person recover from that, especially if they don't have any family nearby or anything like that. I have crisis intervention team training, and I'm the only law enforcement officer in Beaufort County that has that. And once I actually learned that the police department was dealing with mobile crisis services with commitment processes and things of that nature, and I was curious about, what is this service and what do they provide. So learning about what they do and everything, I started making contacts in the sheriff's office and getting it where we could start utilizing their services. And once we started utilizing their services, our commitment processes dropped dramatically in Beaufort County as far as the sheriff's office was concerned. We were able to start just calling them out to calls, and we would always try to wait till they got there and started talking to the person, try to get them up to speed as to what we were dealing with or what our aspect of the situation was. And once they felt comfortable with being there with the client by themselves, we would go to the next call. And likewise, if they were already at a call or on the way to a call and they ever needed anything, they would contact the sheriff's office, and we would have somebody come out there to try to de-escalate the situation. And that's basically what our job is for every aspect, is de-escalating situations and then determining what the best solution is to the situation. With mobile crisis services, they're mainly dealing with mental health situation and de-escalating those problems and making sure the person's safe to stay where they're at, So, we work together hand in hand with that. I try to go out and do the preliminary work, calm the person down, get it where it's safe, and then they come in and they take it to the next level, either totally clearing the problem or seeking additional treatment, whether it's involuntary commitment or outpatient procedure or whatever. Sometimes it's just somebody's medication is not right, and it causes them to have an altered status, a mental status, and they're having trouble dealing with the day-to-day problems of life. And a lot of times if you just fix that problem, fix the first thing, it'll fix everything else, because everything starts at a certain point and goes up. So that's the biggest benefit to us, is just having them coming out and looking at situations. I speak with Judy a lot on the phone. I'll tell her, this is what I got, this is what I think, what do you think, and we'll discuss, what the best solution is. And sometimes, I call them, talk to them, and we decide to just go ahead and, take the person to the hospital. That's going to be the best route. But normally, it's a situation where they can come out and look at it a little bit closer and determine, what the next best option is going to be. And the biggest thing is educating the community and the fact that they exist, because a lot of people in the community still don't know of their existence and still think the only thing you can do is go before a magistrate and take out commitment papers on somebody. So,
I am Dr. Frederick Wilson, Clinical Director at Dream Provider Care Services. We, as an agency, have worked very closely with mobile crisis and integrated family services over the past few years. We are currently collaborating with them on a weekly, at least sometimes daily basis in order to accommodate needs for advanced access consumers. We also have a good relationship and a good collaborative focus on ensuring that these individuals are linked with community resources as well as with other resources to holistically focus on caring for the client as a whole. We do this constantly and thoroughly with mobile crisis to ensure that we address all areas of need related to the referrals that we receive from them. We are also focused on ensuring that through these collaborative efforts that our abilities do meet the needs of other stakeholders within the community. We attempt to lessen the burden on the local emergency departments by being those that are on the front lines and being the first responders to crisis and sometimes even emergent situations that may arise. Our collaborative efforts have also expanded to include some networking with area departments such as probation, Department of Social Services, as well as the Sheriff's Office, the local emergency department, in order to utilize these efforts to better ensure and relay what all of our roles are in these types of situations.
I'm Amy.
I'm Caitlin.
I found out about integrated family services through Mobile Crisis when I called to get some help for my daughter. We come in on a weekly basis. We do see a counselor, a psychiatrist, and it's helped my family, for my daughter and I, tremendously. Things have slowed down. There's no disbehaviorments, there's no outburst, there's no more screaming, no more hollering, no more throwing. We have a hotline we can call any time of day that we need it. My daughter's able to call, I'm able to call, and it's been wonderful. Things have looking up. We're getting ready to go to a new school year. She's got a new outlook. I can sleep again. I'm able to sleep. I'm able to wake up knowing that she's going to wake up with a better perspective of life. No fussing, no screaming, no hollering, no cussing me out, no throwing things, not trashing my house. She's doing a lot better. She cleans. You don't have to tell her but one time. She does her chores, no problem, and she's more active now.
I used to feel mad all the time, and now I'm just happy, a lot happier. Because I used to not do nothing. I would always be rude to my mom and everybody else, and now I'm just like happier and I do what I'm supposed to now. Because I actually have somebody I can talk to and trust that they won't go off and tell somebody else.
She's done real well in the last few months. We're sticking with the counseling, the psychiatrist, and the additions to make sure.
Yeah, like they'll ask what you love to do, like your favorite thing to do is, and they say when you get mad to go off and go do that. Like I like walking and reading books and like listening to music and singing. And they told me if I ever go get mad, just go to my room and go sing music or go for a walk or something when I get really upset.
Instead of screaming or hollering at me, she'll do that, or she'll say, I need my moment, let me have my moment, and she'll do that, which has been very pleasurable for all of us. If there's a parent in need with any troubled child or a remote problem in the home, it is highly recommended to call Mobile Crisis or Integrated Family Services, because they will go past and beyond their call of duty to make sure that you get the help that is needed. They have been the biggest part of my family for my daughter and I would recommend them to anyone. Make the phone call. Just make the call, because they walk with you through everything.
My name is Mona Lassane Towns. As the Mobile Crisis Director, I have firsthand knowledge about the role our service plays in the community. Mobile Crisis Services involves all support services and treatment necessary to provide integrated crisis response, crisis stabilization, interventions, and crisis prevention activities 24 hours a day, 7 days a week. Crisis intervention services are provided at any location in the community to reduce barriers to service delivery. This service is available to anyone experiencing a crisis related to mental health, substance abuse, or developmental disability. Our teams consist of highly qualified and caring individuals.